Surface electromyography is a commonly used, reproducible, non-invasive method for measuring the general electrical activity of a muscle or muscle group. EMG recordings are often used to study the effects of fatigue on the electrical activity of a muscle. The literature reports that as muscles fatigue, the amplitude of EMG recordings increases as a result of the increase in recruitment of motor units. In this lab, we set out to document the effects of fatigue and the amplitude of EMG signal and force output during a sustained isometric contraction of wrist flexors and extensors, under the hypothesis that amplitude should increase over time as a result of increased recruitment of motor neurons. The subjects for the study were recruited from the Regis University DPT class of 2021. There were 5 males and 3 females, and the age ranged from 21 to 30 years old. Subjects were included if they were able to perform pain-free wrist flexion and extension, and they were excluded if they had any forearm pain or surgeries or if they were allergic to latex or had an adhesive sensitivity. For the study, we placed 6 electrodes over the extensor and flexor muscles of the wrist. We confirmed placement with contraction of flexors and extensors against resistance. We adjusted the dynamometer to an appropriate hand grip for the subject and performed a maximum grip test by recording the maximum force in kilograms and peak EMG for flexors and extensors. We then calculated 25% of the peak grip force. The subject then held a constant isometric contraction of 25% of peak force, and we recorded the peak EMG values for both flexors and extensors each 15 seconds. And we recorded the total time until 25% of the peak force could no longer be sustained. For the results section, we used Excel to calculate mean and standard deviation for percent standard of EMG for flexion and extension for each time slot, and we also used Excel to create trend lines. For the results, on the graph, the x-axis shows the time in seconds, the y-axis shows the muscle activation as a percent standard. The orange solid line shows the average muscle activation for wrist extensors for the 8 subjects as a percent standard. The orange dashed line shows the trend line for wrist extensor activation over time. As you can see, the amplitude increases for the wrist extensors. The blue solid line shows the average muscle activation for wrist flexors at each time slot, and the blue dashed line shows the trend for the wrist flexors, which shows a gradual decrease in amplitude over time. From these results, the hypothesis was partially supported because of the amplitude of the wrist extensors increased as predicted, but the amplitude of wrist flexors decreased over time. SEMG is a useful way to measure the amplitude of muscle activation. Recent findings in the literature have supported that the relationship between muscle fatigue and amplitude may be more complex than previously thought due to peripheral factors. Some studies have actually shown a decrease in signal amplitude with fatigue, which could explain the decrease in the wrist flexor amplitude. SEMG could be a very good tool to have in the clinic because it's a non-invasive way to measure muscle fatigue in patients. It can assist with preventative care. Patients can be educated about what activities they may need to avoid due to their muscle strength so that they don't get an injury. SEMG can be used as a measuring tool to evaluate the need of additional exercises or modalities so that the patient can continue to improve muscle endurance. Along that same vein, it can also be used as a measurement of fatigue rates pre- and post-therapy to quantify improvement.